we have a negative biopsy, there's a really good test that has come up, over the past few years, which I really like, which can help us, kind of overcome a little bit of this limitation of having a smaller cancer and not be detected, okay? And this test is called MDX. You hear a lot nowadays about genetic testing and cancer, and that means there's definitely certain lesions in certain chromosomes and the DNA, et cetera, that can predispose people to getting cancer. Some of these are tumor suppressor genes, okay, meaning genes that are special in helping you protect you, and some of those can be deleted or absent or not working properly. And then there's the opposite to that, which is called oncogene, which are genes that promote cancer. Okay, and prostate has both. So there's definitely some genetic testing that can help us with that, but this is not a genetic testing. This is something called epigenetics. And epigenetics is a fancy way to say that you can look at modifications that have been done into the gene afterwards. Okay, so it's not that the gene itself is bad or good, it's that there's certain things that can happen that can, in this case with MDX, is methylation, okay? Methylation is a way of adding a special little thing called CH3, okay? And what happens is that in the case of the MDX, they can measure the methylation pattern around the biopsy. And if it becomes positive, they can detect an area that could have a high likelihood for cancer, even though it didn't show it in the biopsy. This test works best with negative biopsies. It can look at these methylation changes that are often seen in areas where cancer is present. So what they do is they take the biopsies that were taken, they do a special methylation test, and then they can map them and say, oh yeah, this one does not have a little, like a halo in a way. You can think of it as a halo. Okay. So if they have a positive halo of methylation, that suggests that if you ever had to rebiopsy, that would be the area to go for, because it would have a higher yield or a higher likelihood of having cancer in that area. And to be honest with you, this is not a true blood test, because what they do is they actually get the samples of your biopsy. So they get the actual tissue from the biopsy, and they do this special testing. So it's definitely not a blood test, and it's very much with the tissue that has already been taken, so you don't have to go through that misery again of having to be retested.
Got it.
Yeah.
That's nice.
Yeah. So what's really helpful here is that even though we had great technology with the MRI fusion, there are things that are not going to be shown up neither in the MRI nor the ultrasound, but that can be detected by this methylation pattern. So if I had to rebiopsy you, not only would I down the road look at the MRI and the ultrasound, but I would also say, oh, guess what? This area over here was, an area rich in methylation, which suggests that that is the area that would have a higher likelihood of having the cancer.